Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning, Melvin. Good morning to Switzerland.
Good morning, Professor Schmidt, and good morning, good afternoon, or good evening to those who are watching or listening to us today.
The topics we're covering today is Oropouche virus in Latin America. I have no idea if this is the right pronunciation. I've never heard of that virus, but very interesting story. We speak about first documented transmission of Alzheimer's disease, so Alzheimer as an infectious disease. We hear about FDA to accept the first artificial intelligence algorithm to drug development tool pilot. We speak about a multi-country dengue virus outbreak in Africa and about the Butantan dengue new vaccine phase 3 results. Very interesting topics today. Melvin, I'm really eager to start with my Oropouche virus. And this is the story in this very nice review paper. What you see here in these red dots, they show you detections of this virus in midges, mosquitoes, vertebrate hosts, and humans. And you see from 1950 to 1959, up to down on the right side here, 2000 to 2009, detections increase. Now, the big question to me is, did it really increase? Or has it always been there and nobody ever really hardly looked in a consistent way? I think this is an open question, but in the end, it is a very interesting virus because usually this Oropouche virus causes fever, but in some cases, it causes meningoencephalitis, which means infections of the brain and the meninges. In the past 70 years, there has been this observed increase, as I said, but we don't know if it is real or if it is artificial by increased detections. The virus is trisegmented, and that means that it can rearrange the three segments can be exchanged between the different viral strains, and then you have a new virus. So this is a reassorting virus ready for a next outbreak. There are two reassortants known. Human transmission occurs by bites of midges, but it is not clearly understood how it really happens. The whole pathogenesis and the whole ways of transmission, it is not fully understood. The life cycle of the virus is not yet understood. Laboratory diagnostics are crucial, but there is no robust commercial test available. And again, as I said, nobody knows, or I don't know, I didn't find anything, how consistently people have been testing for the virus in the past. The pathogenesis and possibility of extended repeated infections by different orovirus reassortants is unknown. So are you protected from one infection, or can you get two or three or more in the future? And again, this is really something we need to study in the future to look at the potential risk of this virus for a pandemic. Now, having said this, WHO is speaking about disease X to cause a next pandemic. I don't know if Oropouche virus will be the cause of the next pandemic. Nobody knows this. But the message is, as a veterinarian told me, there are 300,000 RNA viruses out there ready to jump from animals to humans. And I think this would be a nice lesson, a nice exercise to get ready to develop a vaccine candidate against Oropouche virus in case it is ever needed. Melvin, any comments, views?
Yeah, so like what you said, there are so many viruses out there. We don't know which ones will be infecting humans or will have the ability to infect humans and really cause disease, right? But this is a good virus to practice if you want to be ready for disease X.
Yeah. Very good. And now you have the story Alzheimer's disease as an infectious disease. What is the story here?
Yeah, this is very interesting. And I really chose this because this is the first documented transmission of Alzheimer's disease from a cadaveric pituitary tissue for growth hormone. So, from the late 1950s until 1985, children around the world with growth issues, they were receiving injections of human growth hormone from the pituitary gland in the brains of donor cadavers Fortunately, this is not being done anymore, but this is just showing us that really Alzheimer's can be caused by infection. So we know that with Alzheimer's disease, there is this amyloid plaque, right? And plaques form when the beta amyloid proteins come together or clump together. And so there could be different ways or mechanisms for this to happen, but we now know that one of that is through infection.
Very interesting. So if I get this right, Alzheimer's disease, forgetfulness, or the whole spectrum, the full phenotype as we know it, there may be different causes, different pathogeneses, and the phenotype, Alzheimer's disease, is always the same. So now it has been shown by children who received from dead bodies pituitary hormones that they came down at some time with Alzheimer's disease, so it is transmissible. And that may be only a part or a fraction of Alzheimer's disease, or it may be all of it. So that Alzheimer's disease may end up to be different types of diseases with different causes. Am I right? Is my interpretation right? Or
Yes, yes.
what is your view?
Yep, that is right. We don't know, right? At the moment, we think that it's really caused by amyloid plaques or neurofibrillary tangles or these other things that are shown here in the cartoon. But really, what it does to the brain is it gives us this phenotype of forgetfulness and many other things that are related to Alzheimer's disease, but it could be different things that can cause it.
Yeah, very interesting. And if it is transmissible, we have to think about the vaccine, right? Melvin, you have another great story on the FDA and drug development and artificial intelligence. What is the story here?
Yes, so for the first time since the FDA launched in 2020 basically guidelines on artificial intelligence, this is the first time that they've accepted the first artificial intelligence powered tool for drug development. And the innovative science and technology approaches for new drugs, or the I stand pilot, was designed to create a new pathway to FDA review for novel tools that may be used for developing drugs. And I think this is interesting because it just shows us that the FDA as a regulator is also really keen to be part of the development that is happening in the world of artificial intelligence. And for this particular tool, they are looking at mental health symptoms and really looking at behavioral signal processing and machine learning to help look at what can be done in order to develop drugs for depression and anxiety.
Yeah. Let me ask you if I understand this right. So they have an artificial intelligence tool which looks at patients, and by looking at the physical movements, pupil changes, vital signs, speech behavior, facial expressions, they look at all this and then they grade anxiety and depression. They assess anxiety and depression. And people at the same time are treated with different drugs against depression and anxiety. And the better drug should result in a better AI-approved scoring of disease reduction. Am I correct?
Yes. So basically, they're putting all the information, facial expressions, speech behaviors, all these things that you mentioned, putting them into an algorithm, and then they will test a drug or let's say a substance and see whether those are improved. And I think it's the ability of the artificial intelligence to really put in all these information together and create something out of it, looking at patterns.
Yeah. And it is more sensitive than just a physician's diagnosis, an impression of a 10, 15, maybe 1 hour talk to the patient. How big is this anxiety, right? This is more.
And also because normally when you have physicians looking at patients, right, there will be differences between the assessment of physician A versus physician B, right? But for artificial intelligence, it's more uniform and harmonized.
Yeah, it is more objective.
Exactly.
Wonderful. Another piece of great news. And after all these pieces of great news, you have one piece of bad news around here. What is this?
Yes, so we always hear about other diseases happening in Africa, right? We always hear about malaria, HIV, tuberculosis, and we always hear that dengue is in Latin America or in Asia. But actually, last year, there was a multi-country outbreak of dengue in several countries in Africa. And over 5 million cases were reported and 5,000 deaths were reported. Of course, this is not as big as the death toll for HIV, malaria, and tuberculosis. But then again, it just tells us that dengue is also a big public health problem in several countries in Africa.
Yeah. And I guess you told me before we started the webcast that the serotype is not reported, right? It is probably serotype 1 or 2, right?
One
But
or
we don't
two,
know.
probably, because those are the ones that are really showing up in most of the outbreaks. Yeah.
Yeah, interesting. So here is some good news, but we had a whole series on dengue virus infections last year. Please refer to that if you want to know more about clinical aspect, vaccines, vaccination, epidemiology, pathogenesis. Here is one reminder that is important for the next piece to understand on a new dengue vaccine by Butantan that Melvin will tell you about. Flaviviruses are transmitted either by mosquitoes or by ticks. And what you see here is dengue is mosquito-borne. So is Japanese encephalitis, tick-borne encephalitis, and Gassanophorus disease. These are vaccine preventable. I highlighted these in yellow. Now, Zika virus has only a phylogenetic similarity with the dengue virus of, let's say, 40 to 44 or 46, let's say 50%, right? This is roughly where the Zika virus, or here is the Zika virus, 40 to 44%. Right? So the reminder here is this is genotyping. And when it comes to infectious diseases, what is important is antigenic typing and antigenic similarity. It looks as if Zika virus is very close to dengue virus, and one may even call it dengue virus 5 from an immunological point of view, because it may give you protection against dengue virus infections. And this is what we're going to cover in this Butantan vaccine story. But before that, as a quick reminder for all of you, dengue is an acute systemic flavivirus disease caused by one of 4 serotypes. It is transmitted to humans by a mosquito. Most infections are asymptomatic. 20% have unspecific fever symptoms. 5% are severe, and that is called dengue hemorrhagic fever with a high death toll. 2.5% globally, lower in rich countries. Now, today, half of the world's population are at risk for infection, 100 to 400 million cases annually with up to 40,000 deaths. WHO just reported, you saw that on Melvin's slide, 500 million cases and 50,000 deaths. No specific therapy is available, and this is why vaccines are so important. To date, 2 vaccines are licensed, Dengvaxia by Sanofi. We spoke about that before. It is a live vaccine based on yellow fever virus. It is a 3-dose schedule. In a study that was done, phase 3, there were unexpected breakthroughs with severe infections. So the recommendation today is that seropositive persons only should be vaccinated with this vaccine. The new kit on the block then recently was Qdenga by Takeda, which has to be given in 2 doses. Again, it is a live attenuated dengue virus 2 based vaccine. Again, Sanofi was yellow fever virus based. This is dengue virus 2 based. But again, it also covers dengue 1, 2, 3, and 4. And in the study that Melvin will show you. No, in the new vaccine we will show you shortly in one of the next in the next slide. And Melvin, now I come to you to your story from the Renal Journal of Medicine.
Yes, so maybe just to give a background, last month Brazil added Takeda's vaccine in its national immunization program. And this is because of a significant increase in cases. So the number of dengue cases in 2024 have more than tripled compared to that same period in 2023, right? So the number of dengue cases are really going up in Brazil. And because of this, Takeda's dengue vaccine was added by the government to the immunization program. But then again, this other good news is that we may have another dengue vaccine available in the future, probably 2025. And this is from Instituto Butantan, which is a government agency basically in Brazil. And they recently published their phase 3 study results in the New England Journal of Medicine, showing an overall efficacy of around 80% in disease prevention, and the efficacy against dengue in seropositive volunteers, so those who were infected with dengue in the past, was 89%, and those who were not infected with dengue in the past, so seronegative, was around 74%. And this is actually good news. This vaccine is one dose.
Excellent. So we have 3 dose Sanofi,
Two dose.
2 dose Takeda, 1 dose Butantan. It's
Yep.
live vaccines. I would have expected that everybody works with 1 dose, but I'm not. I'm not an expert on this. So this is really, really good news. But there is a shortcoming here. But we discuss it a little bit in a minute. So, what is this slide?
Yeah, so this is the results, and we have seen this so many times with COVID for all the different COVID vaccines. But just to show you that the blue line is the placebo, those who did not get the vaccine, and you see that the number of the incidence of dengue is going up, and for the vaccinated, it is basically plateauing. So you see that really the vaccine is effective in preventing against infection of dengue.
The question that I always ask vaccine opponents with that type of slide is, which group do you want to belong? In the vaccinated or the unvaccinated, right? That should take care of any concerns. Here is another view of the efficacy. Can you explain this?
Yes, so we see here the efficacy in terms of seropositives, as I've mentioned, those who were infected in the past, and seronegatives, those who were not infected in the past. As you see, the efficacy is higher in the seropositives as compared to the seronegatives, so 89 versus 70, around 74. And this is also the same for the Takeda vaccine and the Sanofi vaccine. Those who have been infected in the past, the seropositives have higher efficacy. And you will see here as well for dengue virus 1 and dengue virus 2, you see that the efficacy is higher in seropositives versus seronegatives, and this is not really surprising. This is the same, right? But you only see here dengue 1 and 2, you don't see dengue 3 and 4, and because there were no cases of dengue 3 and 4 in Brazil when the study was done.
Yeah, so this is the shortcoming I spoke about, right? They had bad luck. They had no dengue virus 3 and 4.
Yep.
Circulating in Brazil at the time. So this is a nice commentary that you found in the New England Journal of Medicine as well on this study. And maybe you can run a little bit through the bullet points that the editors of this, or that the authors of this commentary came up with.
Yeah, so the comment was basically talking about the fact that there were no dengue 3 and 4 during the time when this was done. And maybe this was due to the introduction of Zika, the Zika virus in Brazil in 2015. And that the Zika virus vaccine, as Professor Schmitt has showed you earlier, they are related to the dengue virus. So maybe the Zika virus infection that was spreading in the country in 2015 and onwards. By the way, they're still spreading to date. There are still Zika cases, not as much as in 2015, but you still see Zika cases being reported in Brazil. So this is one of the reasons probably why you don't see dengue 3 and 4 in Brazil during the time when the study was done. And maybe we will never see them there in Brazil.
Yeah. This is such an interesting disease, and I think we brought very good news today. There are 3 products out there now with the potential for good vaccine prevention. We don't have a final solution. You certainly want to have a measles-like vaccine, 100% effective with 1 dose for the rest of your life, right? So this is not where we are, but good progress has been made in a difficult, very difficult area. So I'm very pleased with our podcast today, highlighting that we are very good on track with the fight against dengue virus. Very good. Melvin, thank you for bringing this up. I think this is really, really nice. Thank you. Finally, that's it. We spoke about the Oropouche virus in Latin America, and we don't know if it has been around all the time, and now we start testing and we find more, or if there's a real increase. We spoke about the first documented transmission of Alzheimer's disease, and we explained Alzheimer's disease is the phenotype that may be caused by different causes and may have different pathogeneses. The outcome is always the same, the phenotype is the same, but at least a fraction of Alzheimer's disease is caused by an infection. The FDA accepts the first artificial intelligence algorithm for drug development against anxiety and depression. Very good. That will help us treat psychiatric disorders in the future. Melvin brought to you the multi-country dengue outbreak in Africa with a high number of cases and a high number of deaths. And then we spoke to you about the dengue virus in general, but we explained the Butantan dengue vaccine phase 3 results in some detail. And with that news, thank you very much for listening today. We will be next week. Thank you very much, Melvin, and I wish you a nice day.
Thank you, everyone, and stay safe.